Well, okay. Hi. Okay, I've got to figure out how to use this. Okay, so I'll tell you what I'm doing up here in just a minute. First of all, I'd just like you to read the intervention that is one of the studies that I've read, and I've read hundreds of them over the last couple of months. So patients from both the treatment group and the control group underwent daily 30-minute sessions of deep tissue massage for 2 weeks. Okay, what do you reckon the therapist actually did? They did what they did. So assume you're the massage... Sorry, thank you. See, I'm not used to this part of things. Assume you're the massage therapist in this study and you're not allowed to assess the client and you're not allowed to really interact apart from just basic pleasantries. Just turn to your neighbour and say, if you had a client come in with low back pain and you don't know a lot more than that, what would you do in your treatment? You've got about 20 seconds each just to give an overview of what would you do in your treatment. Okay, has everyone said something? Shh. Quiet down now. Obviously have lots to do. Okay, so hands up if you and the person you talked to did exactly the same thing with your client. Oh, one person up, two, okay. Yeah, okay, so there are a few people who would have done the same thing. Almost everyone, though, would have done something different to the person next to them. So there are so many studies that basically say this in the study, and we really don't know what the therapist did. The researcher may have more information, but they don't provide it in the study, which makes it really hard for us to read it and know what is going on there. Then there are other studies. Okay, read that one. Non-painful cross-fibre friction massage with slowly increasing pressure was applied over the local myofascial trigger points until a tissue resistance barrier was felt. This technique was executed using the forefinger or thumb and reinforced with the middle finger or opposite thumb, approximately 2 Hertz rhythm, with the muscle in a relaxed position, blah, blah, blah. Okay, so who would do this? And it's not right or wrong, but who would do this in their treatment for lower back pain? Okay, a couple of people, but not everyone. So this is really why I'm up here. I've been a massage therapist now for 13 years. I've been a myotherapist for 5 years, and I keep hearing research results come out, and I might have a bit of a read of it and I go, but that doesn't sound like anything I do. And even the detail of the studies, you can see when you actually read the studies down to what do they do, I go, does that mean that whatever the outcome of this study is can be applied to what I do in my practice? And I have to say, I don't actually think so. I went back to university about 3 years ago to do anatomy in an anatomy lab. That was fantastic. Somehow, someone convinced me to go and start doing a research degree. That was a bit silly, but anyhow, that's where I am right now. I actually have a huge paper due tomorrow, which is why my notes are like this rather than written out properly, so excuse that. All I've really done, though, is come up with so many more questions. I read studies over and over and over and go, I just don't think we have answers to things that we need to know before we can even do this study. So that's just what I wanted to talk to you about a little bit today, because we're all hearing about results of massage studies a lot. But how much does it actually apply to us, and how can we actually move things so that things do apply to us? I'm just going to say up front, I'm only going to talk about massage as we all know it. So put your hands on the body, particularly in terms of people who have pain and injury, because that's what I do, but it applies just as much if you do pregnancy or oncology or relaxation or anything like that. I know that there's a lot of other research going on, so pain science and neuroscience and all of those things, and they're really important. But I'm not going to talk about them today because it's not my area. And I think what I'm going to talk about in context of massage can actually be taken and applied, and we should be using any time we look at research in any field. So if your main focus is one of those other areas or something else, still just ask lots of questions. Okay. So, who here would really like doctors, other health professionals to recognise a bit more that what we do is valuable? That's a better show of hands. So, that's been true for the whole time of massage. And so when massage therapists realised that we needed to start doing research, really the real reason that we started doing research was to try to prove ourselves to other health professionals, more than it was to try to understand what we could do better for our clients. And so we jumped straight into the medical model. And so from the very start, we've done randomised controlled trials, which Ian talked about quite a lot this morning, without much precursor to that. We wanted, because the medical model, that's what's accepted there, we very much wanted to join that and to be able to say, look, we've got results that say we can help people with this situation or that situation. I'm thinking that we might have jumped into that a little bit too quickly, and I'm going to talk about that. So I wasn't going to talk about randomised controlled trials specifically today, but because it has come up this morning, one of the really big things about randomised controlled trials is that we're trying to control as much as we can to make sure that we can work out what works or what element of what we do makes a difference and what doesn't. So if you have 5 different things happening, you want to know which one of those is the key thing that's made a difference in whatever it happens to be. That's really easy to do if you're testing, well, I'm actually going to say it's probably not, but it's easier to do if you're testing a pill. Does it work better if you have a 25 milligram, a 50 milligram or a 75 milligram pill? I don't think massage is quite as easy as that to break down. I'm not disputing the relevance of randomised controlled trials itself. I don't know enough about science to do that, although there's lots of material coming out from very experienced researchers now to raise questions about whether that is the best method of research in a range of situations. One of the things, well, there are a couple of things for massage that are a little bit different to things like pharmaceuticals and probably even surgery. We can't blind our therapists, definitely. You can't have a massage therapist provide a massage treatment and not know they're doing it. So that's a really tricky one in terms of the actual methodology. You generally can't blind the participant either in most situations. People know that they're getting a massage. So we automatically fail a couple of the things that are about quality RCT research. It's hard to come up with a placebo that matches those things. So if you compare massage to some kind of sham laser treatment, people know which group they're in. They know if they're getting massage or if they're getting sham laser. It's not like they know whether they're getting a sugar pill or an actual drug. There was something else I was going to say there too. You can try to compare it to another form of touch, but that's problematic as well. If you have someone providing the real massage treatment and then you have someone else providing some form of touch, that touch probably has a lot of effects in its own right. So it's really hard to say that that's an active treatment that we can then compare it to no intervention compared to the real massage. So we really have troubles using randomised controlled trials. And there are authors right over the time of massage research that have drawn that out and basically written, there are reasons we have low quality research, and they're not easy ones to solve. It's not just because it's bad research, it's because there are genuine problems with it. So the aim of a randomised controlled trial is to control as much as possible so that you know what causes an outcome. In massage, we have so many variables that go together. So massage isn't a pill. Massage involves touch, it involves relaxation, it involves pleasure, it involves pain, it involves interaction. There's a whole lot of things. And a randomised controlled trial will be aiming to pull one of those things out in a particular format and look at what happens. I'm not sure that we can do that. I think massage is a whole experience, and that's really tied into things that Tim was talking about. I think also, in doing massage, that is actually the correct way to do massage. To do research, where you actually outline every single detail so that every participant in the study gets exactly the same thing. We work with individuals, and that's one of the reasons that people choose to come and have massage, because they want an individualised treatment where the massage therapist does care about them and makes the treatment as relevant to them as possible. That's going to create expectations. So again, a lot of things tie together that it's really hard to separate out and then ask about massage. So in a randomised controlled trial, you've got that. How many people said that this is something they might do? What about the rest of us? And does it mean that if someone has studied this and they get a particular outcome, can we then apply it to what someone else does which doesn't look like that, which is often what happens in research? So we've got a lot of trouble doing medical style research. It's not that we shouldn't, but I don't think we have the way to do it yet. So I wrote down a note earlier after listening to Ian, which was really interesting. He was talking about how in testing out the surgeries, you'll remember he was talking about he'd test out rotator cuff surgery and back surgery and this and that. So every single surgery has to go through the same examination. How are we going to do that in massage? Do we test a deep touch versus another touch, someone's protocol versus another protocol? The way we'd have to do it is actually to identify what's best practice and then put that through a randomised controlled trial. But that's a bit tricky because we don't know what best practice is until we have randomised controlled trials. So we're in this circle of how do we actually move forward in knowing what works and what doesn't. So in doing my research, which I'm only just getting into, as I was reading, I was going, I have so many more questions than any of my reading has answered. Maybe we're actually asking the wrong thing. Maybe instead of asking whether massage works in a way that we don't yet actually have, a lot of reason to have confidence in, maybe we should be asking questions that should come before that, and then see if we can build up a picture that helps us ask that question in a better way. So one of the things is that the right form of research for us? It's definitely the gold standard from a medical perspective. It's considered, as Ian was saying, there's a lot of push for the randomised controlled trial because we need to know what causes what. Can we do that, though, in a way that's fair to massage? There's been a number of papers that have indicated that massage is actually more like psychology in its application than it is necessary medicine. And so psychology has, I think, gone down a number of different paths in trying to solve research issues. And one of those is to simply take case studies. So it's called the N of 1 trial. So to treat each person as an individual with their own history, their own symptoms, their own situation, and to look at what happens with particular interventions, and then for the therapist to be very careful in writing that up and submitting that as a form of evidence. There are also observational studies looking at what happens rather than how does this cause that. Yep. I am hopeless with devices like this, I really am. So I'll just go back to this slide because obviously I've forgotten it. There was actually someone who interviewed massage therapists who'd been the massage therapist in a trial and asked them what their experience was being that therapist. And a lot of them were talking about the whole experience of having to apply a protocol, and a couple of them said something very similar, and that was that it was challenging because it wasn't consistent with individualising the treatment to their client, and they really found it hard if they could feel something under their fingers that would normally make them go a particular way, but because they had a protocol to follow, they couldn't do that. They had to ignore that client in order to apply the treatment. Now, that's being true to the protocol in the trial, but in itself, the massage therapist being uncomfortable in that situation can cause a confusing element as well. So not even the fact that they didn't treat the client, but the fact that they're uncomfortable could well flow over to the outcomes. Okay, so we've got the N of 1 trial, we've got observational, and so observational is not about establishing cause and effect, it's about watching what happens. There is a paper out there that actually compared the outcomes, I think it was in psychology, of observational studies compared to randomised controlled trials, because it's always been assumed that randomised controlled trials are going to be the studies that have the ideal results. Actually, the results weren't so different. And so I think a lot of questioning is going on in the scientific world about whether the randomised controlled trial is really the only way that we can do this. There's a study, it was actually done quite a few years ago, but it was only published last year, and Beck put it up on, I think it was the public page, was it? Not that long ago. I haven't got the whole title there because it's quite long. But these researchers, who also included massage therapists in the research team, actually said, we want to find out what happens in the real world, not under experimental conditions. And so they sent, they had GPs identify who might be appropriate. They sent those to massage therapists in the community who could do whatever they thought was appropriate. So they had up to 10 sessions. They could do anything that they would normally do, but they were asked to document it. And they actually involved these massage therapists as research personnel rather than just as massage therapists doing a protocol. They actually got really good statistical figures out of that when it came down to how people benefited from the treatments. That's not proof that massage works, but it's a different type of question to a randomised controlled trial. Does massage work? So it kind of indicates that we should be looking wider than just the medical model when we're looking at massage. So what questions should we ask? Researchers for 2 decades now have been saying to massage therapists, you need to define what massage is so we can go and test it. That's a little bit tricky. So there was a study, again, it was a few years ago, but it's only just been published, where they got together 32 massage experts in the US and asked them, they got them together to talk about and to try to define massage. And they basically, in the end, agreed that they couldn't agree. But they had some commonalities. They said that there's more to massage than just soft tissue manipulation. It's also very much about the relationship, about the environment, about the context, about expectations and everything else. Sorry, researchers, we can't actually help you out yet with a definition. And I think after doing all the reading I've done, I don't think we should be trying to ask that question because we don't know enough to define massage in a way that's going to be useful in research. So I wanted to, you had the special effects, I didn't work those out. I was going to do the fly one in at a time. Yeah. Okay. So what questions could we be asking? There are lots of questions that have been suggested over time. So there's lots we need to know about the therapeutic relationship. Tim's study is a perfect example of how we need to explore things that we don't know enough about yet. What about clients? Why do they come to us? What do they think about us? What do they, how do they feel afterwards? There's things that really have not been explored in studies. There are maybe only 2 or 3 studies that actually look at the experiences of clients after receiving massage treatment. That's a big area. The area that I'm getting involved with is what about the therapist? So all through the research again, there are people who call for more information on the therapist who provides the intervention, even if it's a randomised controlled trial. Who are they? How much experience do they have? Does it matter how much experience they have? Does it matter what training they have? What type of work do they specialise in? All of those things. But they never talk about that in the papers. So one of the questions that I'm really interested in, rather than someone picking out some random protocol for me to follow in a study, I want to ask, what do you actually do? So in whatever field of massage that you're in, what do you do? Because we're all going to do totally different things, but maybe we have things in common that then can become the things that we start to research. So if we deal with people with back pain, for example, we'll all do different things, but maybe we've all found that we use a certain pressure, or we have to address certain issues, or maybe it shows that we really don't. It's very much dependent on the person. But we don't know because no one's ever asked. Who's a good massage therapist? That's a bit of a challenging one. And I think it's going to be different depending on the issues that you're dealing with. So someone who is good with injury and pain is not going to be the same as someone who's good with pregnancy massage or with mental health issues or anything like that. But there was a study, again, I think psychology, I've read quite a few psychology papers in doing this, where it's a bit awkward, but they attempted to take it was physiotherapy, sorry. They attempted to take the outcomes of patients in a hospital who'd been treated by a range of physiotherapists and then work those outcomes back to who got better outcomes and who those therapists were. So that then they could try to study what those therapists do. I don't think we can do it like that, but I think it's an important question. In whatever field it is, who gets outcomes consistently or frequently that clients want? What do they do? What do they do that's different to someone else? What do they do that's the same, but it's about who they are? So lots of questions there about who the therapist is. Does experience matter? Does it matter if you're straight out of school or whether you've been in the business for 25 years? Does it matter what training you have, what qualification you have? We don't actually know. There are a couple of studies that have looked at whether the years of experience that a therapist has is relevant. They kind of indicate maybe, but not firmly enough. But then, what is expertise in massage? I've never heard that question before. There was one study in the US, and Anthony Porcino actually did his thesis on this, his PhD thesis, and I love this definition. It's not going to help us in terms of how we research massage, but I think this is just perfect for what I think of in massage. Individualisation involves adapting treatment to the needs of the patient in the moment. Individualisation starts with initial assessment and continues throughout the treatment. Expertise is depicted as more nuanced and skillful individualisation and treatment, evolved through experience, ongoing training, and spontaneous technique exploration. So basically, we have a client where something didn't work, so you try something else. And when you find something that works, you try it on the next person, and it may or may not work. And you learn for yourself how to be with clients. So I actually thought I had another slide in there. There's one other area that I think we can do randomised controlled trials a little bit more successfully. We can ask questions like cortisol. So Rebecca mentioned that earlier. So what are the physiological effects if someone receives a massage? What happens? What happens in the muscles? What happens in the body? All of those things. We can ask a little bit about dosage. So when you have a pill, they ask how much should you receive and how often should you receive it. We really don't know anything about that with massage. And it's probably going to be individual, but we need to be asking the questions. Is it better if someone comes 3 times a week like they do with physio or chiro? Or is once a week enough because we tend to have longer sessions? Should our sessions be 10 minutes or an hour? We work on what we've always done, but they're questions that I think have never been asked either. The other one is pressure. People will often say, especially on social media, that the pressure needs to be at a level where it's not painful. Fair enough, but I've not seen any research about that. There are actually a couple of studies that show that moderate to firm pressure is more effective than light pressure. Now, that might depend on the context as well. Is that with someone with back pain, or is that with someone who's trying to relax? Who knows? So I think these kind of questions where they're a bit more specific, they're ones that we can ask more generally, but perhaps they're the ones that we can initially take into experimental conditions, and then we find out more that maybe helps us be able to ask better questions about how massage will, whether massage works, because we can then specify that in the study with a bit more confidence. So when I read hundreds of papers recently, it really was that we were asking one question over and over. Does massage work with, name whatever you want? I just think maybe we need to ask different questions, not just that one, and think about whether we ask them in a different way. So qualitative research, observational studies, things that give us information that at some point we can feed back into experimental work. I kind of think we're not at the stage where we can be good with experimental work yet, because massage is not a pill. It is a totally different experience and interaction. I have no idea what time it is, so thank you. Okay. Oh, there you go.